Hello and welcome to my channel. In this section, I will be from now on summarizing some research that I feel that is important to our knowledge of endometriosis. And I will be aiming to do it in a rather simple way, understandable to most patients out there, summarizing and focusing on the main findings of each paper. The paper that we'll be discussing today comes from France and attempts to give us an answer to the very commonly asked question, which is how frequent or how likely is that I will need repeat surgery for endometriosis. Of course, there's no single best answer for every patient, and each case is different. However, we need to acknowledge that this is the largest study that we have available regarding this pertinent question. The authors attempted to assess the risk of repeat surgery during the long term after the primary surgery. They looked up to 10 years with a median of 5 years of follow-up after the surgery. And all those cases, those more than 1,000 cases, were operated by a single surgeon, expert in that field, which assures the fact that obviously these were appropriately managed cases with complete excision of the disease. They looked at almost 1,100 patients, which is a large number. As regards the type of the disease, we know that there are three types of disease. We know we have deep endometriosis, then we have superficial, and also we have ovarian endometriosis, or OMA. So the vast majority of them, almost 9 out of 10, were deep endometriosis cases with various localizations, including many of them affecting the patient's bowel. So what the authors found when they looked at the data was that 155 out of those 1,100 patients needed repeat surgery during that long-term follow-up. And when they looked at the reason for the repeat surgery, they found the majority was due to recurrence of disease, recurrence of endometriosis, 108 cases, with 39 of those due to infertility as part of artificial reproductive technology treatments, and in only 8 cases there was a possible association with recurrence of endometriosis, but that was not definitively confirmed. And what is important in terms of numbers, and giving us that number, is the probability. When they calculated using their statistics the probability, they found that of course the probability raises as the time passes from that first surgery, and it can reach up to 28% during that 10 years after that surgery. So the probability of repeat surgery after complete first surgery for endometriosis may be as high as 28%. So are there any protective factors? Are there any things that we as clinicians can do, or the patients can do, to reduce that risk of repeat surgery? The authors found that there are two things. One thing is the hysterectomy. Having a hysterectomy at the first time during the time of the first surgery may have a protective role to reduce that risk of repeat surgery. But also having getting pregnant after surgery may also reduce that risk of needing repeat surgery. So summarizing, we say that the risk and the probability of needing repeat surgery is almost 30%, 28%. So the patients need to know that this is the actual number. I personally think that two things that are important here is to say that hysterectomy in patients who have completed the family should be carefully and thoroughly discussed with the patient during that first surgery. It should not be a taboo to do a hysterectomy. The patient is clear that he does not want any more children. Removal of the uterus with preservation of the ovaries should be at least thoroughly discussed with the patient. And the other thing is, of course, pregnancy. Yes, we do seem to think that pregnancy may reduce the risk of recurrence, but of course we need to also remember that pregnancy itself is not a cure for the disease. There's still some clinicians, unfortunately, may be recommending pregnancy as a form of treatment of endometriosis. We do know that this is not a treatment, but it can actually reduce the risk of needing repeat surgery. And I will be discussing that in the near future. There's been a recent paper now regarding the patient's perspectives, how patients feel when they're told to get pregnant to cure their endometriosis. So that takes us to the end of that first video discussing research pertinent to endometriosis. I hope you enjoy that. If you do, feel free to subscribe, share the content, and I hope to see you again soon. Thank you.